So, so we have been, awarded by various, reputed journals and reputed media houses, right? So your guide for today is, we have Dr. Ankit Malhotra, who is, head for pathology, consultant head for hematopathology, neuropathology, and molecular biology at Manipal Hospital Cancer. Right, welcome, Dr. Ankit.
Good
Then we
evening.
have Dr. Preeti, who is, founder of Inclusive Wellbeing, and she's an occupational therapist and holistic mental health coach. Then Dr. Gagi, she may not be joining because of some family issues, but she drives the oral health. She's an expert for oral health, right? And I'll be covering up for her in case she doesn't join. Right? So let's start, right? So if you see, we have gone back in history. In 13th century, plague had wiped off 1/3 of the European population, right? And no one knew what happened, why people died. People thought it was a bad luck or there was a huge mystery, right? And we are in the similar situation right now, right? So when it comes to chronic disease and cancer, we don't know why we are developing those diseases, but 41 million people every year globally die of chronic diseases, right? The thousands of millions of dollars spent on uh, pharmaceutical research. So most of the interventions are based on giving drugs for the disease which has already occurred, right? Rather than just finding why we are developing diseases, right? So it is not bad luck, but it is just something bad is happening inside our biology and chemistry, which is making us develop those diseases, right? So, and our body always gives signals, right? So our body always gives signals that something is wrong, and unfortunately, we don't have any sort of clinical investigation or scientific investigation which can decode those molecular signatures, and we end up developing symptoms, and then the modern healthcare method actually try to manage or suppress those symptoms using drugs and antibiotics, right? And if you see, in 1990, Human Genome Project was started, right? Which was sounding promising because we thought we will find some sort of insights about why we are developing these lifestyle diseases, right? But still things have gone. The number of people suffering from various chronic diseases, be it diabetes, cancer, cardiovascular disease, have been increasing, and the genetic doesn't have an answer to this, right? Uh, so if you see the chronic disease burden is increasing, everywhere. The prevalence of type 2 diabetes and cancer has been increasing, especially among younger population. We are seeing people less than 35 years of age, developing cancer situations, developing type 2 diabetes, right? And so because most of the interventions are not asking the right questions, and that's why we really need to shift the focus from genetic and modern medicine methods to actually epigenetics, right? Uh, so this is a few glimpse of scientific research paper which tells that genes plays a very minor role in chronic diseases, right? So if you see, only 5% of the diseases can be blamed to our genes, right? And these are rare genetic disorders, right? So they are rare. So that's why that's why they call rare. They happens only in 5% of the population, right? But they are not responsible for our chronic issues. Right? So this is our research on 1,002 twins, right? Uh, which happened, which showed that twins even responded differently to foods. Their postprandial triglyceride, glucose, and insulin responses were very different to identical meals, which clearly testifies that it's it actually it is not about genes, right? And it is more about, what we have found is more about the trillions of bacteria, microbes going on inside our various parts of the body. So we have all, yeah, so we have all science and technology in place, right, to actually understand why we are developing these diseases, right? So we now have, next generation sequencing technologies to understand, what is causing us, develop this disease, and then probably, we can collect, millions of molecular data around it, which can be mined through computation technology and artificial intelligence to actually find out, a right set of interventions, right? So we can, using science and technology, we can prevent and reverse chronic disease. We can prevent, reverse cancer. We can improve our health span, right? So till now,
41.
healthcare sector has been,
आपने रिप के इसके नीचे का कर लिया
41.
हाँ टाइट आराम से करना है
Who's the 42?
sorry. So currently the healthcare system has been focused on two major things. One is academic research. Basically, there are a lot of, scientists doing thousands of research around chronic diseases, but those research, mostly research sit in the cloud servers, right? So there's no use of it, no application of them, right? Second is pharmaceutical research, which is really done by doctors and healthcare and, hospitals, where there's a lot of drugs, right? Because just to manage disease or make it less bearable, or, extend our lifespan, but they are not actually curing disease, right? So we really need to move from pharmaceutical strategies to nutritional strategies, right? To actually solve these problems. So this is an image of an 103-year lady, right? She was nicknamed Hurricane, and her name is Julia Hawkins, and she had been running 100-meter race at the age of 103, right? And it's all she's not been on any drugs. It's all because of right nutrition choices that she's been living in, a healthy lifespan, right? And so what our body is actually a sack of biochemical activities, right? And which generally means that it's biology plus chemistry, which we really need to decode and then apply mathematics to actually find out the root cause of these diseases and develop right set of interventions. So if we talk of microbiome, right? So essentially, if you see, our body has around 25,000 human genes which we get from our parents, but microbes has around 2 to 20 million genes. So essentially, we are at best 1% human, at worst 0.1% human, right? So again, there are 100 trillion going on inside our body, right? And these microbes perform critical biological functions, right from digesting food to providing us nutrients, to talking to brain, immune system, training immune system, regulating our blood sugar response, regulating our satiety, and the number of these functions, right? So and then we also have, so majority of the microbes living in our gut, in our large intestine, right? The second largest version of microbes live in our mouth, right? And they play a key role in our immune system, in immune health, right? And they not only leads to development of oral health issues like gum disease, periodontitis, or gingivitis, but they are also said to cause various immune mediated diseases such as heart disease, obesity, diabetes, even dementia, right? So these are few of the research papers which establish a connection between the microbiome and various diseases. So so it has been now found that microbiome also play a role in development of cancer and even preventing cancer, reversing cancer, right? So these are few research papers which came in NCBI articles. Again, from obesity and weight loss perspective, right? So there's a specific bacteria which whose gene, when overexpressed, can deplete GLP-1, and GLP-1 we know is required for glucose homeostasis, right? So an overexpression of genes of this particular bacteria, Enterococcus faecalis, can actually deplete GLP-1 and make us gain weight, right? So again, it is not about calorie in, calorie out, but it's more about the interaction between microbiome and our body and the food we eat. So what is the way forward, right? So we really need to have a digital footprint of our body, right? So what we are doing at this front is basically we need to analyze our biological samples, like it can be stool, saliva, vaginal swab, or blood in future, what we are doing, right? And we convert this, we analyze this, these samples into uh, biochemical activities, biochemical reactions, and huge molecular biodata sets, biological data sets, which actually are so we built machine learning models where we can convert these into the functions of the microbiome, right? And then and the metabolites being produced by them, and then then we can actually apply mathematical models to determine what sort of nutrition choices our individual should adopt to actually reverse the disease, right? So again, I'll now ask few questions to Dr. Ankit, right? Who would share a bit about in terms of the how the modern medicine is working towards chronic disease, and where are the gaps, and how microbiome and modern medicine can work together, right? So Dr. Ankit,
Yes.
can you just share a bit about the current pathology practice in the modern medicine method, specifically within the diagnostic?
Yes, correct. Hi, good evening, everybody. I'm Dr. Ankit Malhotra here. So I'm a pathologist by profession, and my areas of work involve in hematopathology and neuropathology, and also in molecular diagnostics. So as a pathologist, right? So we are tasked with uh, reporting on cases and giving an opinion which forms a diagnosis and which dictates the treatment for the patient going forward. And whatever the procedure, like suppose a physician takes up a biopsy tissue and sends it to us for us to study and make an opinion and form a diagnosis, is what forms a part of my work sphere. Yeah. So in that sense, I am at the crossroads for understanding how disease works, and the challenge we face in understanding disease. So if you talk of the first point, talking of high variability results, I would like to tell you that try to make you understand the point that
वीना दीदी भी बैठी हैं
sorry.
Yeah, you can continue. Yeah.
Yeah. So, the point I'm trying to make you understand is that the fact that whenever a sample or a tissue specimen comes to me for a diagnosis, patients and physicians and general public needs to understand these few facts. One fact being that a disease to show up in the tissue, in the body, in an actual physical form, when you see it under the microscope, there is a significant time lag and a delay between your condition or a disease to start and finally end up being picked up by the diagnostic test. So we are still missing a major chunk of diseases in that interval between when the disease starts and when it finally gets shown up in your test. You can test, could be a blood test, could be a biopsy, could be even a molecular test. So that is the current frontier and the current area of active research in modern medicine, that what are the reasons that how can we bridge that gap between a disease starting in the body and before we are able to pick it up. And this lag period, or a latent period as we call it, this could vary from weeks to sometimes years and decades also.
Yeah.
So, these are the kind of issues we face.
So this is what we discussed initially, that
Yes.
current modern medicine methods are unable to diagnose the molecular signature. So probably our body always gives a signal via molecular indication that something wrong is going on, right? And
Yes.
and that's where we actually lack. So do you think there is an
And Sushant, the thing is that even the molecular abnormalities,
Mhm.
they take some amount of time to actually get picked up.
Yeah.
So that is the area of research. When you talk of epigenetic medicine,
Yeah.
we are talking of some environmental or some other factors which are influencing our own genes.
Yeah. Yeah.
And the the microbiome in our gut especially is the latest frontier which we are finding out that it plays a huge role
Yeah.
in influencing our own genes. So we might not be able to, the mutation might not be picked up by testing, but the bad microbiome or the dysbiosis we have, that definitely can be picked up with the current research which is coming forward.
Yeah. So also I wanted to understand, because what I have seen is personally also that when we go to different labs,
Yes,
we'll have different results, right? And
yes, yes,
there's a lot to do with both medical and non-medical causes, right? So
yes,
how do we actually take, or doctors take
yes.
decision based on blood test reports, right? Because ultimately
Yeah,
there's
yeah.
variability, right? So what is your view?
Yeah, it could be blood test, it could be any tissue biopsy, the way of interpretation. So it's very subjective at a biopsy level, but even in a blood test, people have, the studies have, for example, I'll tell you an example of vitamin D. It's been shown that so much of our population is deficient in vitamin D. So much so that people are now considering whether the lab, the control test the test, what do you call, the test limits, what is the lower level of vitamin D before you start calling people deficient. Even that might be different in Indian population. So we might not be actually deficient, but because the control values are being derived from studies done in the Western world and applied to us, it might not hold true. So in the same way, a lot of our investigations, how we interpret them, that becomes a very subjective situation. And the physician not just goes by, he doesn't treat the report, he treats the patient. So your reports can have subjective interpretations by different physicians.
Right. Because what I've seen is, I'm not sure how well this is prevalent in India, but
Yes,
most of the dietary guidelines, right?
yes,
In terms of vitamin, in terms of milk, in terms of meat, in terms of sugar, right?
yes, yes,
It's actually influenced by food industry, right? And
yes, yes,
and most of them promote, dairy, fats, and sugar, right? As a preferred way of consuming a lot of foods, which is actually causing dysbiosis in the gut microbiome, right?
absolutely, absolutely.
So,
So not just the fact that we are taking data from the West,
yeah,
we are also, the data and our own body is kind of controlled in a very indirect way by the food industry
yeah,
and how we assess.
yeah,
So we need to have our own data sets to understand our own population, and to go, to make medicine more personalized, we need to have much more data about our own population.
So that's what I wanted to also understand one more thing, sir, because there's a lot of these, wave of artificial intelligence, machine learning technologies, right? Generative AI, a lot of these stuff, right? So all
Yes,
these can run successfully, subject to the right relevant data sets which are belonging to chronic disease and cancer, right? So
yes,
considering the huge data what we have from a diagnostic perspective, right? So we have been
yes, yes,
doing diagnostic investigation for almost last 30-40 years, right?
yes.
Is that data relevant to actually prevent diseases, or we really need to build the molecular biology data and the microbiome data as a fulcrum? And so what is your view on that?
But data is data, but the times have changed and evolved with the advent of molecular techniques and deep sequencing. Now we are able to understand much more of the mechanisms how disease happen.
Yeah.
So just like a medicine, the science of medicine keeps on evolving with time.
Yeah.
So the way the data measured back then, some 30 years back, not necessarily it might hold true. We need to come up with more and more evolved data sets, and that is what progress is.
Yeah. So I firmly believe that, even the molecular data, probably what we are collecting. So when we sequence the microbiome, we collect
Yes.
130 million bytes of data points. But again,
Yes.
continuous learning, so the point what I have seen is, if you go for a lipid profile, if you go for a blood test, or you go for LFT, KFT, it will, for the last, if you go for 5 years, it will show up the same parameters, same results. There is no continuous learning, right? So that is
Yes. Yes.
something we really need to build, right?
We do.
So
We do.
yeah, uh so
There
also,
needs to be a whole sea change of
yeah,
how disease is viewed, by the patient. Like, for example, I'll give you an example of
mhm,
there was a big controversy about the egg yolk and the cholesterol content in it.
yeah,
For the many years, the American physicians have advocated that the egg yolk contains harmful amounts of cholesterol and should not be eaten. And there has been a debate going on in the medical community for the last 20 years.
yeah,
And even now, and recently, they have come up with a final argument saying that the amount of cholesterol in it is not harmful and
mhm,
it's actually beneficial
yeah,
and should be had without any problems whatsoever. So, the understanding of body and the disease is constantly evolving. Why
mhm,
is it evolving? Because of more and more molecular techniques and the better understanding of body because of these molecular techniques.
yeah. In fact, since you brought this question about cholesterol, I'll just take a bit of time and mention about it. So probably
Yes,
we know that only 30% of the cholesterol comes from the food we eat, right?
yes, yes,
20% our body makes it, right? So essentially, for everyone who's listening, it is not always about food, right? So if we have an abnormal cholesterol levels, it has more to do with the dysregulation in the biology, right?
absolutely.
That's something. So another thing I wanted to ask is, so in terms of the range of test results, right? So
Yeah, yeah,
there's a huge range, right? So if we talk
yes.
HbA1c or triglycerides levels, so how do doctors actually consider this? Because a person may have abnormal levels, but it will show as normal, right?
Yes, yes. No, that ranges have been set after a lot of population-based studies. They actually went around and measured the levels in huge population sets, cohorts of thousands, 2000s.
Yeah.
So just by that technique, it becomes little subjective and open to different interpretations.
Okay.
So what I'm trying to again emphasize is that suppose a patient comes up with a cholesterol level which is on the higher side, out of range to what is prescribed by the results.
Mm.
The strategy, what we believe till now, is to cut down on cholesterol intake. That strategy needs to be thought about with a more understanding of the body, how our gut microbiome and our own genetics play a part.
Mm.
That slightly high result might be actually normal, but it could be extremely high based on what your biology says about you.
Yeah, yeah, you're right.
So if you want to understand yourself more, you need to study yourself more, and of course, you can't take your case in isolation,
Mm.
but to build more data and to understand body and to evolve and to understand medicine and
Mm.
physiology more,
Yeah.
these steps of gut microbiome are in the right direction.
Okay. 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 Thanks, Dr. Ankit.
Thank you.
Yeah,
Thank you.
thank you. So I'll ask Dr. Preeti to actually. There have been a lot of. We know that gut and brain are connected to each other through vagus nerve, and a lot of thing which happens in the gut doesn't stay there. It spreads everywhere, right? And the food cravings, the stress, depression, anxiety, the weight gain. A lot of this has to do with the gut-brain connection, right? So let me ask Dr. Preeti to share her thoughts on the gut-brain connection and how we can, modulate the gut microbiome to regulate our mental health. Right?
Hello all, good evening. So I'm Dr. Preeti, I'm an occupational therapist. So generally when we deal with our patients or clients who, come to us for a therapy or intervention for their mental health, let's say it's depression or ADHD or any such kinds, we always foster holistic guidance and intervention. So we actually emphasize a lot on food, protein, and lifestyle, along with the stress reduction techniques, or the thing that helps with their mental health or nervous system regulation, because mostly the mood dysregulation is closely associated with this nervous system dysregulation also. And when it comes to me recommending food and lifestyle changes, there comes the important role of microbiomes. And there comes the important role of nutrition, because the food that we consume today hasn't, there are a lot of things that has to be improved, because our digestion, our inability to absorb all the nutrition is sometimes getting poor due to the gut dysbiosis, as Shishant sir said. And so the stress, the chronic stress or any kind of chronic mental health issues directly affects the gut health, and it's vice versa. If the gut health is poor, and this also send the signals to the brain in a indirect way, which is affecting our mood. And in this aspect, what I learned through my journey of intervention with my patients is, recently I figured out this microbiome focused intervention when it comes to food and nutrition is very vital for their mental health recovery, be it an adult or a kid. Because the occupational therapist also has a huge role in serving to clients who comes in a pediatric setup, like autism, ADHD, or developmental delays, etc. And for them also, the concentration on the food and this gut health is very important. So in this way, that only through this we can promote a holistic recovery, or else a relapse might occur, because the medical inputs from a psychiatrist is not enough. It's been it's been already said, and in many research articles it's been continuously being said that the medications, the antidepressant drugs, or everything has its own limitations. It is not, it can support in a short term or in a temporary basis, but for the actual recovery we need a much more an in-depth intervention. And when it comes to that in-depth intervention, this microbiome focused intervention is very much required. And I personally feel that not only with regards to the post disease or post conditions, but this microbiome focused interventions, or some, it should be also in a preventive based changes should also be welcomed, because in the lifestyle that we live in, the preventive based strategies which involves this microbiome focused interventions or support, that's very necessary in the coming days, because this lifestyle that we are living in, the food that we consume doesn't have enough thing that our body needs, or even our mental health needs. That is how I observed or learned through my personal journey as well, and also along with my clients' journey.
Okay, so I'll add here a bit. So what in addition to what Dr. Preeti said, right? So essentially, even what we have found in our research is that the bacteria living inside our body, inside our gut, they actually 90% of the serotonin, right, is produced in the gut, right, not in the brain. So so serotonin is one of the happiest hormones. It regulates our mood, right? It regulates our
obviously
feeling, right? Similarly, dopamine, 50% of the dopamine which gives us pleasure, right, is produced in the gut microbiome. GABA, which regulates our mood, behavior, our which it is also, microbiome has a role to play in the production of GABA. Fight and flight response, right? The fight and flight response essentially it's say, why they are not.
Yeah, it essentially stems from this nervous system dysregulation due to
Yeah. So
adrenaline impacts.
yeah, so
Let-
some bit of fight and flight response is necessary in case of emergencies, right? But if it's too high, if we are too much stress or too much overwhelmed with something, or we are experiencing too much anxiety, right? So this can again further imbalance in our which impacts our brain health and in turn impacts our gut, and it's a vicious cycle, right? And that's why we say when we so essentially there is a very interesting story here, that what happens is that if if you are in a forest and you are being attacked by a tiger, right? So the best thing, you're not worried about your digestive system or immune system. You're just worried that I have to run, right? And that's your fight and flight response comes into picture, right? And that's a similar thing in our body. When we are too much stressed, there's a huge release of cortisol, right? So it tells our gut that something is wrong, and our body shuts all the non-essential systems, right? So the digestive system, immune system, right? Only thing working is breathing and blood circulation, right? So essentially, we have all these sort of issues. That's why we say when we have stress, it's linked to our insulin resistance, because it tells our body that there has to be a lot of things are going haywire, right? So probably let's store the food which we have eaten. So that's why your food, what you eat, gets converted into fat, and that's how you start gaining weight and you have insulin resistance. Similarly, immune system response, right? So immune system doesn't work, so obviously you have overactive immune system response, and then you have all sort of immune mediated diseases as well, right? So essentially a gut brain connection plays a very key role. It has also been found that people in child, the child who is suffering from autism, ADHD, or more, right? They have imbalanced gut microbiome, right? So there have been huge research, and in fact, we have a specific product for child where we address issues like autism, ADHD, eczema, child obesity. So I think this is one of the major key areas of research in terms of understanding the neurological disorders. In fact, there was a research which found that people with bipolar disorders, if they go for a fecal microbiome transplant, right, their brain can start working normally.
Okay.
So
And yeah, one more point, like even the people with adverse childhood experiences, and because of that chronic stress that they endure at that point of time, disrupts their gut health, and it affects their mood, and all such. The research evidence is also there.
yeah,
Like PTSD
yeah.
in such conditions.
So thanks, Dr. Preeti, for your valuable insights. Now we'll move to, in fact, Dr. Gargi is not there, so I'll be taking up the oral microbiome, right? So we'll be discussing in detail about the microbes living in our mouth. So like our gut, which is the largest colonization, which has the largest colonization of the bacteria and viruses and fungi and a lot of these species, right? Mouth is the second largest colonizer of microbes, right? It has around 100 billion microbes with 770 different species, right? So and the point is everywhere in a mouth, right from tongue to teeth to throat, right? Saliva, gums, everywhere has a distinct microbiome population, right? And mouth is actually referred to as the starting point of the digestive tube, right? So it's not small intestine or stomach. It's actually your digestion starts from the mouth, right? So essentially, again, similar to our, we have a huge saliva inside our mouth, and every day we swallow around 1 liter, 1.5 liter of saliva every day, right? So essentially, a lot of these microbes and bacteria which live in our saliva actually move from saliva inside our gut, right? And then so there are a lot of bacteria which are found in our gut actually belong to the bacteria in your mouth, right? So again, saliva plays a very key role. So like like gut, it's it's really, we need to maintain a very mildly acidic pH level in the mouth, and which saliva does, right? So highly acidic environment is something which is a breeding ground for pathogens, right? And saliva also provide nutrients to good bacteria, and even starve bad bacteria of nutrients. So it plays a key role in neutralizing a lot of pathogens, right? And there are a lot of immunoglobulins which saliva has, which actually also finds the harmful microbes and kills them, right? So essentially, a balance in the oral microbiome is something which is really key to our overall dental health, right? So right from periodontitis, gingivitis, gum disease, bad breath, dry mouth is all linked to imbalance in your oral microbiome, right? So it can be due to wrong dental hygiene, wrong dietary choices, too much consumption of sugar, right? Maybe selecting right type of toothpaste and brushing techniques, which we'll be discussing soon after this slide, right? So again, oral mimics the gut architecture, right? So like 70% immune cells in our gut lives in our gut, what we call is GALT, right? We have immune system in our mouth as well, what we call is mucosal associated lymphoid tissue, right? And again, it acts as an headquarter for the immune attack, right? So if there are a lot of pathogens, so your microbiome actually through various release of metabolites, they tell immune system something is wrong, and they start attacking, and that's why if they are overactive immune response, that is what makes us develop disease such as gingivitis and gum disease, right? So when immune system launches attack inside the mouth, right, it do kill pathogen, but it also impact the other organs inside our mouth, right? So essentially, then overactivation the overactive immune response and the inflammation is one of the reasons why we have this tooth decay and plague and gingivitis, right? So that's how the entire system works. So if the imbalance in the oral microbiome, if oral microbiome is not performing optimal functions, right? So the innate immune system, right, it recognizes this thing and inform the adaptive immune system, and the adaptive immune system launches the attack, right? And again, if this attack is for prolonged period of its furious, right, it can impact organs inside our mouth, and that's how we can have cuts on our gums and inside our mouth, and that's how a lot of these bad bacteria can actually move from the mouth to different parts inside the body, right? And that's why a lot of people do not know that the imbalance in the oral microbiome is connected with dementia, it's connected with irritable bowel syndrome, is connected with type 2 diabetes, obesity, even arthritis, right? Because a lot of these bacteria move from oral in case of leaky mouth and spread at different parts of the body and start doing inflammation, right? So that's
it's also very linked. If in dentistry, if it's a very common practice to put the patient under a very strict antibiotic cover before you do any dental procedure. Because if any of the bacteria in the mouth enters into the bloodstream, you end up having bacteria inside your heart, on the heart valves, and you can end up a life-threatening endocarditis condition. That's a very big risk. So I think that's what we are getting to understand more and more now.
But Dr. Ankit, when we take antibiotics, is also kills the good bugs, right? So
it does, and we didn't know until now that what are the side effects or the drawbacks of antibiotics. We probably just thought that saving the life is more important than forget about the bacteria in the mouth. The patient should not end up with a heart infection. But the fact that we still do see cases of heart valve infection without patients having undergone any dental procedure. That means there are issues like this which can still cause seeding of the bacteria into the bloodstream without any actually procedure.
Totally agree. In fact, there are certain, so a lot of food what we eat is
Yes.
pre-digested by these oral microbes, right? And
Yes, yes.
they actually produce certain molecules. For instance, when you eat a lot of beets and greens and like spinach, like lettuce, right? So they produce nitric oxide, and nitric oxide is set to regulate your blood pressure, right?
Yeah,
To regulate
vasodilates,
your
yes.
insulin sensitivity. So essentially, oral microbiome has a role to play in prevention of obesity and type 2 diabetes as well, right? Which probably there's a lot of research going on around it, right? So essentially, people who so patients who have gingivitis, right, or gum disease have a higher risk of developing type 2 diabetes and obesity as well. Right, so that's what we discussed about, that oral microbiome dysbiosis is connected with number of systemic diseases. So whatever happens in mouth doesn't stay there; it spreads everywhere, right? So this is one of the research which mentions that oral microbiome dysbiosis in elderly causes Alzheimer's, dementia, because there's this bacteria called P. gingivitis and Streptococcus mutans. They actually move from mouth to different parts, including they cross the blood-brain barrier, goes to the brain, and it causes dementia in older population, right? So essentially, then even as I mentioned about cardiovascular disease and type 2 diabetes, right? So these are certain research papers which establish the connection between oral microbiome and heart disease as well as diabetes. So people who have periodontitis, right, which is again a advanced version of gingivitis, have diabetes, right? Again, IBD, right? So as I mentioned, a lot of these bacteria, so this is specifically in case of when we have, so we know this, probably Dr. Ankit, you can also add here that.
Yes, yes.
So, 1/4 of the Indian population suffer from acid reflux once in a month, right? And
Yes.
most of the interventions which are available are basically your PPIs, right? Protein pump inhibitors, which try to,
They deal with the symptoms. Yeah, they don't treat the cause.
yeah. So when you have a low stomach acid, or when you take PPIs, you have no stomach acid. So a lot of these bacteria, including Physiobacterium nucleatum, right, which moves from oral, crosses the stomach, which is stomach is highly acidic. But since you don't have stomach acid because of
The
PPI,
drug.
this can move
Yeah.
to gut, and this is one of the bacteria which causes colon cancer, right?
Absolutely.
Right, so
Absolutely right.
essentially, the oral microbiome is connected with IBD, Crohn's
Yes.
disease, ulcerative colitis, because of this similar bacteria, Physiobacterium nucleatum, and also causes at a high end causes colon cancer. Similarly, in case of
It is
yeah.
it is so highly connected that fecal microbiota transplants
Yeah.
is actually now a therapy which has been approved by the FDA in
Yeah.
treatment of inflammatory bowel diseases.
Yeah.
What they actually do is they collect fecal samples, they collect feces from 5 or 6 healthy people.
Yeah.
They mix it all together. They create a suspension in saline liquid in water, and
Yeah.
they actually put a nasogastric tube into the patient and
Okay.
directly plunge that into the small intestine and the colon, which actually has shown miraculous results.
Yeah. And this thing, H. pylori infection. In fact, H. pylori is an oral bacteria, not a bacteria found in small intestine, right? So
In
essentially,
stomach, yes.
yeah. So it actually moves from oral to stomach, right? So even in pregnancy cases, right? So a lot of pregnant female have this, gum is really permeable and there's very dry mouth and gum, right? So essentially, there's a really need of having a better hygiene in oral health when someone is expecting, because a lot
Yes.
of these gingivitis, these bacteria can actually move out of the gum to the various places, and this is one of the reasons why there have been adverse pregnancy outcomes and preterm births, and issues in the neonatal neurodevelopment as well, right?
Yeah.
So yeah, so this is again something important I wanted to discuss with everyone here, is that toothpaste and mouthwash, right? So generally we do not see when we go to buy a toothpaste brand, right, we generally go by ads like Colgate or Vico, right? But the thing is, almost 99% of toothpaste have certain ingredients which are actually bad for our oral microbiome, right? Like SLS. SLS is something, if you have an icy cold feeling when you're using a toothpaste, right? It is SLS. It is one of the most, harmful, ingredient. It actually strips away the mucosal lining. It causes dry mouth, and it is also said to lead to, hormonal imbalances, right? Similarly, triclosan and parabens, both are endocrine disruptors, right? And you will also disrupt the gut microbiome composition, right? Aspartame, we have a recent news on the aspartame, as a possible cause of cancer, but aspartame, saccharin are two artificial sweeteners which are found in toothpaste, mostly toothpaste, right? And this is one of the reasons why, oral microbiome triggers type 2 diabetes and obesity, right? Because artificial sweeteners actually makes our pancreas release a lot of insulin, but there's no glucose to be metabolized. So that's why, there's a very huge flow of insulin inside our blood, and which slowly leads to insulin resistance, right? And similarly, propylene glycol, right? It causes dry mouth and, absorb a lot of moisture from the mouth, right? And when there's dry mouth, there's a high acidic environment, which is a breeding ground for pathogens. So it leads to imbalance in oral microbiome. This because a host of, other systemic health issues, right? Similarly, brushing techniques, right? We should generally use soft or extra soft brushes, right? As the gums are really, really sensitive, right? Hard brushes can impact our gums, right? And allow bacteria to enter gums, which can again trigger inflammation. So again, this is what we are launching in next month, right? So we're launching Asia's first oral microbiome test, right? So we will be using your saliva to actually analyze your saliva to understand the biochemical activities happening inside the mouth, right? And convert that into huge data points, which we'll be using our a machine learning model to convert that into biological pathways, and then give the right set of nutrition intervention to regulate your oral microbiome, right? So this is what we are coming up with in next month, right? And really this will be really a hallmark in case of dental health as well as systemic health issues, right? So again, here we'll talking of the our nutrition platform, which we have been successfully running for almost 3 years now, right? So essentially, let us talk about, when we talk of nutrition, it is really, really, really underrated in India, right? If you talk of nutrition, it's if you talk to a mathematician, right? If you ask a question, what is 2 into 2, he'll say 4, right? And that is a standard answer, that is objective, right? So that is scientific, right? But if you go to different nutritionists, they will give you different diets based on the same inputs, right? Which is again a sort of guesswork, right? So essentially in India we have around 5,000 nutritionists, right? And so all these are based on human belief system, anecdotal evidences, right? So it is not objective or science driven, and that's what where we come in. So what we do is essentially, for us, foods are not foods, but foods are a sack of molecular ingredients, right? So 25,000 plus molecules are there in the food, right? So our recommendation is entirely scientific and data driven, right? So when we take your biological sample, whether it is saliva, whether it is stool, or whether it is vaginal swab, right? We actually convert that into your biological pathways, right? And then we apply a mathematical model to actually map the various molecular ingredients with these biological pathways, right? And we determine, okay, if I'm going to feed certain molecules to your gut, what is going to come out, right? Is it going to be a nutrient or toxin? And depending upon that, we determine, okay, we map these molecular ingredients with the foods, various foods, and then we give you the right set of food nutrition recommendations, right? For instance, let me give an example. If I talk of spinach, so spinach has vitamin D, vitamin B12, iron, right? But it also have oxalate. So if your microbiome cannot neutralize oxalic acid, right? So oxalate, so spinach may land up with your in your avoid list, right? But again, we need to fill the gap for our iron and vitamin requirements. So essentially, we replace it with some other food which has those molecular ingredients. But if we cannot do so, then we recommend some supplements, right? So again, as I mentioned, it's all self-learning, right? So with every molecular data set, we are learning, we are feeding our platform, we're actually enhancing and bringing more precision into our platform, right? And this is entirely data driven. There's no human involved, there's no nutrition involved, there's no biotechnology involved here. So that's how our entire platform works. So we take your biological sample, it runs through a sequencing machine, and then we get a raw data which is run through our bioinformatics, which is going to get converted into molecular data, right? And we use that to actually give the food and supplement recommendations, right? And we are soon launching our supplements, right, which will be make to order based on your own microbiome, right? So after we do your test, after we analyze your biological data, probably we'll be making the supplements to order based on specific need your body requirement right now. So these are just to mention, these are the biological pathway score we cover. So there are 24 plus scores in our flagship gut test, and there are more score for our Lil Bio, which is a gut testing for babies. Then Vagico, we have another set of 7 scores, and then oral microbiome, we have a set of 10 scores apart from these standard of the gut scores which we give. So these are few examples about the nutrition, right? So essentially, when we talk of brain and cognitive health, we check your what kind of neurotransmitters or hormones are being produced or being released by the microbiome, right? That drives your brain and cognitive health, right? Similarly, heart and metabolic health, we look at TMA, methane gas, bitrate, tryptophan, absorption of vitamin D, magnesium, right? Which determines how well our heart and metabolic health is functioning, right? Similarly for gut health, so leaky gut is something which triggers a lot of autoimmune diseases, right? So we can actually, studying your molecular data can tell you whether you're moving away or towards autoimmune diseases by studying your functions of your microbiome, right? Which triggers pro-inflammatory activities. So again, this is something how we calculate the food recommendations. So if someone has a high sulfide gas production, right? So the foods which are high in sulfur, such as cabbage, cauliflower, broccoli, garlic, would come in avoid list. And similarly, superfood would be ash gourd, artichokes, right? Or we recommend certain food extracts, like, such as Lactobacillus plantarum, or some food extract which can actually regulate the H2S production score. Similarly, bile acid metabolism, again, a lot of 90% bile acid actually it's primary bile acid which is actually used in the small intestine when we digest fat. A small bit of it goes into our large intestine, and large intestine actually it turns it back into our gallbladder. But actually, if you have an abnormal bile acid, right? So certain foods like turmeric, right? We generally say haldi, turmeric is really beneficial, but actually if you have an suboptimal bile acid, so turmeric would find itself in the avoid list, right? Similarly, we have to minimize brown rice or soybean, and we have to take cucumber, pumpkin, orange, or turnip as superfoods, right? Another example is the TMA, which is again a byproduct when we eat food high in choline, right? So this gets converted into TMA, which goes through liver and gets converted to TMAO, which is one of the hallmark for development of cardiovascular diseases, right? So some of the foods which may be required to avoid, as you rightly mentioned, eggs, right? So eggs is high in choline. So if you have a very high TMA production, so you may have to avoid eggs in such case, but it's not for everyone, right? Similarly, kidney beans, shrimp, which are all high in choline, right? And superfoods obviously can be pumpkin, orange, turnip, right? And so this is the last section which we wanted to discuss, right? And it is from a diabetes perspective. So we have been listing a lot about glycemic index, right? So we determine consumption of food or its avoidance based on its glycemic index, right? But it works on an flawed assumption that every individual digests the food in the same way, which is wrong, right? So essentially, every individual responds to food differently, right? That's why we need to really look at the glycemic response, right? So we do have CGM machines, but again, CGM machines tracks the response of a meal, not of a specific food, right? So essentially you can't find out that, whether a food is spiking your insulin level, your blood sugar level or not. And even, when you talk of type 2 diabetes, right? So it is a last stage of metabolic syndrome, right? So we start developing diabetes 15 years back. So your gut microbiome actually creates a situation where first your insulin spikes, then your glucose level spikes, then your blood sugar level spikes, right? And the
Yes,
focus
yes.
has to be on preventing the insulin from spiking in the first place, right? So essentially, most of the interventions are based on low carb diets, high protein diets, right? Without understanding a unique biology, right? So that's what we are actually bringing this now, that based on so we are covering 15 microbial pathways course, right? Based on these pathways, we can predict whether a food is going to spike your insulin level, right? Even before you eat it, right? So essentially, you can find out if spinach is going to spike my blood sugar level or not. So these are a few pathways what we look at, right? So pro-inflammatory are LPS production, high glucose metabolism, uric acid, oxide metabolism, tyramine, and these are pro-inflammatory. The higher them is, the higher is the insulin response to food, right? And we also look at not an individual food, but also how a food when combined with others actually spike the insulin, right? And from the anti-inflammatory perspective, we see the bitrate and the acetate production. We see the indole acetic acid, right, which is again an byproduct of tryptophan, right? Similarly, indole propionic acid, GLP-1, PY are the hormones which regulate our glucose response, right? So we'll be offering with each of our tests, whether it is gut, whether it is vaginal, whether it is oral, right? So essentially you can find out whether a food is going to spike my insulin before you even consume it, right? So that's what we had, and we are open for questions now.
If
Sushant,
I may, yes.
sorry.
Please
Yeah,
go on, go on.
One query regarding the insulation spike.
Yeah.
So what is it that we are looking at? Sorry for the background noise, I'm outside.
No problem. Yeah.
So the insulin spike you're saying for the certain things. So will you be suggesting the meals also, or will you be suggesting which food to have to reduce diabetes or pre-diabetic condition?
Okay.
How is it that you'll be suggesting, and is it any app that you are planning to launch?
Okay, so how it will go is, so let's take an example, since Gaurav, you had signed up for our of the gut solution, right? So the kind of recommendations what you get, right? So apart from that, we'll be also seeing the response of each food, insulin response of each food, right? Based on your microbial pathways, right? So if your food is insulin response is pretty high, that would come in a void list, right? So you can even check. So we'll be giving a platform where you can actually, check which food is, you'll get a list of foods which is spiking the blood insulin level, how much, right? Which is a medium spike, low spike or high spike, right? And whether the food is in avoid list, minimize list, or enjoy list.
Got it. Thank you.
Yeah, Sushant.
Yeah.
Yeah, I was just wanting to put forward a point across.
Yeah.
Yeah, let's take, for example, we take an example of inflammatory bowel disease. You call it Crohn's or ulcerative colitis.
Yeah.
What people should understand is the patients who come with these diseases are actually been suffering from some or the other symptom for the last year, 2 years, maybe 3 years. That means the latent period before the disease is actually presented to the doctor is already 2-3 years.
Yeah.
And the disease which started in the body, that probably initiating everything happened maybe even 7-8 years or 10 years back.
In fact, yeah.
Easily.
Yeah.
So this is the kind of platform you are providing, these products, that a person will be able to understand his own biology of
Yeah.
his relationship to his food
Yeah.
and what works for him for not. And, maybe he can modulate that
Yeah.
and reduce some of the risk factors which he may end up having a autoimmune disease.
Yeah, so I'll add here what Dr. Ankit said is basically, so we can, when we study your microbiome, we are actually studying the, your biology at a molecular level, right? What molecules are being produced, being released by your microbiome, how these molecules are triggering production of pro-inflammatory things, right? Pro-inflammatory molecules like TNF alpha, right?
Yes.
Now they are changing the genes expression, right? So we can tell you what is making you develop IBD. For instance, you spoke about IBD, right? So it is
Yes. Yes.
ulcerative colitis. Is it because of high sulfide, or is it because of leaky gut, or it is also because of the oral microbiome moving from the mouth to the gut, right? So when
Yes.
we know that reasons, we can actually find out what food molecules should be fed more of, so that it can suppress the pro-inflammatory activities, and what food should be avoided, right? So that it modulates your inflammation, and it promotes anti-inflammatory activities, right?
Yes. Yes.
So essentially, it's like making nutrition, or personalizing food as medicine.
Absolutely.
So, Sushant, one more query. There is a friend of mine who just recently got to know that he has an autoimmune disease, which
Okay.
is a thyroid related.
Yeah. Yeah.
So, how can we help him? Because he started on the steroids. He's been prescribed some steroids because he's not been able to get over the fever which comes to, as in he's in a almost in a state where 24/7 he has fever. So now they have put him on steroids, and since last 3-4 days he's been having loose motions, kind of a diarrhea. But they have still suggested steroids only to him. So how can we help him?
So Gaurav, so how long he has been suffering with this?
It's been couple of weeks only.
Okay. So thing is, again, steroid are actually trying to suppress your immune system. So I think he's moving towards, he may be, if it's steroids, he may be moving to a Hashimoto's, right? So essentially he may also having some food allergies and food intolerances as well.
That I'll have to check because he's a friend who shared with me that he's not been able to get over from the fever.
Okay.
He did couple of tests and everything. It's been what? Since June he's been going through this. So
Okay.
whole June he was having fever. Then he got to this place in Medanta. They did some tests, and then they came out with a analogy that he has an autoimmune disease because of his thyroid, something to do with his thyroid, and
Yeah.
because of that he's having this.
In fact, probably, it's all linked to the gut microbiome. Even, as I mentioned about the oral microbiome, it can be toothpaste can also be a reason, because it is one of the hormone disruptors. But, that is something which is just a way I am thinking, right? But obviously to find out, we really need to, study his microbiome, right? So essentially,
So
we have
if I may add.
Yeah.
Yeah. So Gaurav, in this case, right? Studying his own gut microbiome might be helpful in controlling his disease if he actually ends up having a confirmed autoimmune.
Yeah.
Okay. So offering him this test and offering him this understanding of his biology might help in controlling his disease. It might, if he responds to it well, it might even allow him to be off medicines completely.
Yeah.
If he starts responding to it.
Yes, right, Dr. Gaurav. So Gaurav, the thing is, that I think he started developing around 10 years back, right? So
Right.
actually we are actually currently addressing a person suffering from Hashimoto's, and she has recovered quite well in 1.5 months, right? So what we can do is we can connect Gaurav offline. We can speak to your friend, right? We can understand his problem. If possible, we can help him. So any
Sorry,
other question?
am I audible? Am I audible?
Yeah, Gaurav. Yeah.
Yeah,
I'm
so my dad's been going through a very bad gas issues. So whenever he eats any non-veg, he gets that bloating and the whole system goes for a toss.
Yeah.
And for the next 2-3 days, he is always in pain.
Okay. So we can actually, Gaurav, we can connect offline. We can speak to your friend, right?
Sure, sure,
Right. We can discuss in detail and how we can help him.
sure. Perfect.
Yeah.
We'll do that.
Any other questions, please? So fine. I think we'll close this and so thank you everyone for coming and attending this webinar. We'll be sharing the recording of this on our YouTube channel, right? For those who are interested, you can have an access to our YouTube channel. I can listen to this recording, right? Thank you everyone. Thank you, Dr. Preeti. Thank you, Dr. Ankit, for this.
Thank you.
Thank you.
Bye.